Hello friends, here is a quick video on dwarfism. Now dwarfism means short-statured individuals, and it's a proportionate short stature, means the length of the limbs and the height of the individual, they are all proportionately less as compared to the normal individuals. Now you know the height is because of the growth hormone primarily, and dwarfism occurs because of the growth hormone abnormalities. So obviously one would think that deficiency of growth hormone will result in dwarfism. Yes, that's right. But there are varieties of dwarfism. In some, the growth hormone is deficient. In some of them, the growth hormone is normal and yet it results in dwarfism. And in some conditions, the growth hormone levels are even higher than normal and yet it results in dwarfism. So let's see some of the conditions of dwarfism, or rather variants of dwarfism. First, the commonest one is the pituitary dwarf. That is, there is decreased secretion, synthesis and secretion of growth hormone before puberty, of course, and therefore the length of the bone cannot increase, resulting in the short stature. So that's a lack of growth hormone. And of course, mediators of growth hormone are called as somatomedins or insulin-like growth factors. So lack of growth hormone and lack of mediating factors. Somatomedins are also deficient in this condition. Now coming to the second type of dwarfism, it's Levy-Loren dwarfism. It is seen in the African pygmies, short-statured individuals. Now in this, growth hormone levels may be normal or maybe even less. But primarily, it is because of the deficiency of somatomedins, particularly somatomedin C or IGF-1, insulin-like growth factor type 1 is deficient, and therefore even if growth hormone is normal, yet because its mediator is absent, therefore it results in dwarfism. So that's Levy-Loren dwarfism. Third type of dwarfism, now this is interesting, Laron's dwarfism. In this, the growth hormone levels may be normal or even may be higher than normal. Now imagine this, that the growth hormone is, the level is higher than normal and yet there is dwarfism. Why? Because of the resistance to the growth hormone action. What happens is the growth hormone receptor does not respond to the action of growth hormone. So growth hormone receptor insensitivity, resulting in the dwarfism called as Laron's dwarfism. And the fourth one, which is not commonly discussed, is the Kasper-Hauser syndrome. Now this is also called as psychological dwarfism. Now in this, the growth hormone levels may be normal, growth hormone production is normal, somatomedin production is also normal, and yet there is dwarfism. So let's understand this last type, which is less commonly discussed. It is called as psychological dwarfism. Now this is a I fondly call such points as physio plus plus. They give you some plus plus information and it gives you more marks in the exams. So this is psychological dwarfism. Now what happens in this? Growth hormone levels are normal. Levels in the sense, growth hormone production is normal in this condition. But growth hormone release is low. Do you understand the difference? Growth hormone is being produced, but it is not being released normally. Now this condition, which is called as psychological dwarfism, is seen in the conditions where a child is going through emotional trauma throughout his childhood, there is childhood abuse or neglect throughout the childhood. These conditions, psychological conditions, result in this psychological dwarfism. So growth hormone is being produced but is not being released normally because the hypothalamo-hypophyseal axis is affected. Hypothalamus and its control of the anterior pituitary and release of growth hormone. This axis is affected. So even if the child's growth hormone synthesis in the anterior pituitary may be normal, but it is not released normally. resulting in dwarfism. So even if there are provocative stimuli like exercise or fasting, they would not cause the growth hormone release. Growth hormone is there, but it's not being released, resulting in this psychological dwarfism. This condition is reversible. So if the emotional turbulence or the emotional settings are removed, then this condition is reversible and growth hormone release can start, because growth hormone is being already synthesized but not being released. So these are the various types of dwarfism. The last one will be of interest because growth hormone is normal, growth hormone mediator is normal, and yet there is dwarfism. So many such things we discuss regularly on our channel. If you have not yet subscribed to the channel, it's a good time to subscribe now and hit the bell icon.